Welcome to 10 Minute Health Tech, the AI-powered podcast, where we dive into healthcare technologies and companies so you don't have to. I'm Anthony.
And I'm Julia.
Today, we're going deep on Devoted Health. They're a Medicare Advantage provider, and they're making waves with their idea that they're transforming healthcare for older Americans.
Oh.
But they're saying it's more than just another insurance plan. They're building, like, a whole system around well-being.
A whole system, yeah.
What does that even mean?
Right. And to understand their approach, it's really helpful to start with their take on the current healthcare system, the U.S. healthcare system. They see it as a bit of a dinosaur,
Oh,
expensive, fragmented,
yeah.
and struggling to keep up with the needs of today.
Like trying to run a marathon with a sprained ankle.
Yeah, exactly.
Okay.
So Devoted Health is pointing out that a system designed for the health issues of a century ago, it isn't equipped to handle, like, the rise of chronic diseases. Think heart disease, diabetes, conditions that require ongoing management, not just one-off treatments.
Right. Yeah. Okay, so how does Devoted Health plan to address this? Their website lays out 5 key components. They start with Medicare Advantage plans, but they're quick to point out it's not about the, nitty-gritty details of coverage. It's about offering benefits that people actually use and can see real savings from.
Think about it. What if your Medicare Advantage plan helped cover a gym membership?
Correct.
Or provided a stipend for healthy meal delivery services?
Oh, okay.
Things that actually contribute to your well-being, not just treating you when you're already sick. That's the kind of approach Devoted Health is taking.
Interesting. And to help you navigate those benefits and the complexities of healthcare in general, they have member service guides. They describe it as like a concierge service, someone to hold your hand through the whole process.
It's like having a personal assistant for your health. You know, how overwhelming it can be dealing with insurance, finding the right doctors, understanding all the jargon. Devoted Health wants to make that easier by providing personalized support every step of the way.
So it's kind of removing those barriers to entry, those hurdles that people typically have. Okay, their third ingredient is a focus on a strong local provider network. So instead of being limited to a small group of doctors, they partner with trusted physicians and hospitals right in your community.
This is really about making quality healthcare accessible and convenient. You're more likely to see a doctor regularly if you can find someone you trust nearby, right?
Makes sense.
And building relationships with local providers is also important for coordinated care, making sure everyone is on the same page when it comes to your health needs.
Now, here's where it gets interesting. Devoted Health also has Devoted Medical, their own in-house medical group. And this is where they go beyond traditional Medicare Advantage and offer additional services like virtual and even in-home care.
This is key. They're not just connecting you with existing doctors. They're supplementing that care with their own team of clinicians who specialize in the needs of older adults. And what's really important to know is that Devoted Medical isn't meant to replace your primary care physician.
So it's about working alongside your existing doctor, providing extra support, coordinating care to ensure you get the most comprehensive treatment possible.
Think of it like this. You have your primary care physician who you see for regular checkups and routine care. But what if you need help managing a complex condition, coordinating appointments with specialists, or even just getting help with everyday tasks that impact your health? That's where Devoted Medical comes in.
Got it. It's like having a whole team of healthcare professionals in your corner working together to keep you healthy and well.
Exactly. And to tie all this together, Devoted Health has Devoted Software, their own technology platform designed to streamline the whole experience for their members.
And this isn't just about processing claims and bills.
No, Devoted Software is designed to be proactive, using data and AI to identify potential health issues early on, and make sure members get the care they need before small problems become big ones.
So instead of waiting until you're sick, Devoted Health wants to use technology to keep you healthy.
They're talking about things like personalized reminders for screenings and checkups, follow-up care after a hospital visit, and even alerts for potential medication interactions.
It's like having a virtual health advocate constantly looking out for you, using technology to keep you on track and make sure you don't fall through the cracks.
That's the idea. And here's where the system aspect really comes into play. Devoted Health isn't just like throwing technology at the problem. They're integrating it with personalized support and a focus on building strong relationships with both members and providers.
So it's less about replacing human interaction and more about using technology to to enhance it, make
Mm.
things more efficient, provide better insights, and ultimately free up healthcare professionals to focus on what they do best.
Caring for people? Exactly. Now, let's dive a bit deeper into devoted medical, because this is where a lot of the innovation happens. They offer a range of specialized services that go beyond what you'd typically find in a traditional Medicare Advantage plan.
Okay, like what? Give me some examples.
Well, think about the challenges older adults often face. Chronic conditions like heart disease or diabetes, they often require coordinated care from multiple specialists. Devoted Medical can help manage those transitions, making sure all your doctors are on the same page, and you're getting the right treatment at the right time.
So it's about filling in the gaps,
Hmm.
providing extra support where traditional healthcare might fall short.
Right. They also offer services like medication management, helping you understand your prescriptions, ensuring you're taking them correctly, and even coordinating refills so you don't run out. They're looking at the whole picture, not just treating symptoms in isolation.
Right. This brings us back to that idea of devoted medical strengthening the relationship between the member and their primary care physician.
Absolutely. Devoted Medical isn't trying to replace your PCP. They're acting as an extension of that care,
Hmm.
providing additional resources and expertise so your primary doctor can focus on, what they do best. It's a team-based approach with everyone working together for your benefit.
And it sounds like a lot of this hinges on that idea of proactive care. Devoted Health is really emphasizing their use of technology to identify potential issues before they become major problems.
Right. Devoted software plays a big role here. They're using data and AI to analyze medical records, claims data, even information from wearable devices, to identify patterns of potential risks. Think of it like having a super smart early warning system for your health.
Oh, interesting. So instead of reacting to a health crisis, they're trying to get ahead of it, catching things early when they're easier and less expensive to treat.
Exactly. Imagine getting an alert from your Devoted Health app saying, hey, based on your recent activity levels and blood sugar readings, you might be at risk for developing diabetes. Let's connect you with a nutritionist and get you started on a preventative care plan.
Wow, that's a whole different level of healthcare. It's like having a personalized health coach in your pocket.
That's the idea. And all of this is designed to improve health outcomes, reduce costs, and ultimately make healthcare a less stressful and more empowering experience.
Okay. So we've covered their 5 key components, but where does devoted health fit into the broader landscape of Medicare Advantage?
Well, remember, Medicare Advantage is an alternative to traditional Medicare offered by private insurance companies. Devoted Health is one of those companies. But they're trying to set themselves apart with this unique focus on a holistic, proactive, technology-driven approach.
So are they just another insurance company with a fancy marketing campaign?
Yeah.
Or are they really offering something different?
That's the million-dollar question, isn't it?
Hmm.
I think what's interesting here is that they're not just talking the talk, they're actually putting these ideas into practice. They're investing in technology,
Yeah.
building their own medical group, and really focusing on that member experience.
And they're not just a small niche player, right?
Right.
Devoted Health is currently operating in 20 states, and they're continuing to expand their reach. That suggests there's some real momentum behind their model.
Right. And I think that growth speaks to a larger trend we're seeing in healthcare. People are increasingly looking for more personalized, proactive care. They want to feel empowered and in control of their health. And Devoted Health is tapping into that desire.
It's like they're trying to shift the entire paradigm of healthcare from reactive to proactive. Instead of waiting for people to get sick, they're trying to keep them healthy in the first place.
It's a bold vision, and it remains to be seen if they can fully deliver on it. But they're definitely raising the bar and forcing the rest of the industry to take notice. They're saying, hey, there's a better way to do this.
So Devoted Health is definitely shaking things up.
Mm-hmm.
In the world of Medicare Advantage, it begs the question, is this model the future of healthcare? Or is it just a fancy experiment with a limited shelf life?
That's the big question, isn't it? And while it's still early days for Devoted Health, their approach does align with some significant trends that we're seeing in the broader healthcare landscape, the shift toward value-based care, the focus on patient empowerment, and the integration of technology are all gaining traction.
It feels like they're trying to solve a puzzle that's been stumping the healthcare industry for decades. How do we provide high-quality, affordable care? Care that's personalized and truly meets the needs of individuals.
Exactly. And their focus on preventative care and early intervention is particularly interesting. What if we could move beyond just treating diseases and start focusing on preventing them in the first place? That's a game changer, not just for individual patients, but for the entire healthcare system.
Imagine a world where your healthcare plan
Hmm.
is actively working to keep you healthy, not just waiting for you to get sick.
It sounds almost utopian, doesn't it? But that's the kind of vision Devoted Health is putting forward. And if they can even partially achieve that, it could have a ripple effect throughout the industry.
Yeah. It makes you wonder, what other innovations are on the horizon? What other ways can we leverage technology and data to create a more proactive, patient-centric healthcare experience?
And that's the exciting part. Devoted Health is just one example of the disruption that's happening in healthcare right now. We're seeing new companies, new technologies, and new approaches emerging all the time. It's a dynamic and rapidly evolving space. And it's going to be fascinating to see what the future holds.
Well, we've covered a lot of ground today, from Devoted Health's unique model
Yeah.
to the broader trends shaping the future of healthcare. What stands out to you about their approach?
For me, it's the way they're combining high tech and high touch. They're not just relying on algorithms and data. They're also emphasizing the importance of human connection and personalized support.
I agree, and I think that's a key takeaway for all of us, regardless of our age or health status. Healthcare is ultimately about people, and the most effective solutions will be the ones that combine cutting-edge technology with compassionate, human-centered care.
Well said.
Thanks for spending 10 minutes with us, and be sure to look for more 10-Minute Health Tech podcasts.
Yeah.
Bye.